All right, so I'm going to start with the, excuse me, transtibial. First thing you need is to get your bandages and your tape. So you need two 4-inch bandages. There's two size bandages, small and large, 4-inch and 6-inch. So you need two of the small ones, the 4-inch, to do this. And then you're going to need tape. So I usually reserve 2 pieces of tape per bandage. So I'm going to get 4 pieces of tape ready. Much, much better to have your tape torn and ready to go before you start so that you don't have to try to hold your bandage in place and rip tape. You're going to take your first bandage. You're going to start on the lateral side of the residual limb. You always want to unroll your bandage on top so that you're not pulling it out from underneath. It'll just roll more smoothly if you go from the top. You're going to start on the posterior lateral part of the leg. When you come down, you're going to come over the medial corner and then come back up over the lateral corner. It's really important to get the corners of the residual limb because of where the scar is going to be. We talked about if it's got a good blood supply, they're going to put the scar on the very bottom. So ignore what I'm doing right here for a second. But if you would look at where the seam is on this prosthesis, that would be where a normal scar would be. But it's probably going to go from about here to here. If the person had some vascular issues, that's where they'll take their posterior flap and pull it up on front, and you're going to see like a little frowny thing right here. But again, the corners are going to be here. If you're not careful, if fluid develops and edema develops, it's going to tend to pocket around the corners. They actually call that dog ears because you'll have like little projections almost that kind of stick out on the sides. So we don't want to let that happen. So again, we're trying to control edema with this, so make sure you cover up the corners with your wrapping. So that's one of the first things we do. So we're going to start on the posterior lateral side. We're going to go over the medial corner, up over the lateral corner. This is where it gets really tricky. All right? You need to kind of roll this underneath where your hand was and then get your hand right back on it. Now we're going to what we call anchor above the knee. So right now I'm just laying the bandage. When I was down here, I was kind of pulling it to add some tension. Up here, again, tension distally, not so much proximally. Here I'm just kind of laying it down. So I'd have my person kind of lift their leg. I'm going to put one on just to kind of hold it in place there. Then I'm going to come back down to where I started. And I'm going to go over to reinforce so that now I can finally lift my hand out of the way. Now from here on out, I don't need to go above the knee again, so I'm going to use all the bandage that I have left to just cover up as much skin as I possibly can on the residual limb. So we're going to make, again, like a figure 8 pattern. You don't want to just go in circles. When you go in circles, you tend to form a tourniquet. So we're going to kind of diagonally go up and down, try to cover new area, and again, pull fairly tight down at the bottom. When you end, you don't want to end right at the bottom. You can end front, back, side, anywhere that you want, just try not to end right at the bottom. So I would have the patient lift their leg for me because they could do that. And you want to try to move this as much like a person as you could. And then I'm going to tape it down. Also, make sure that you are taping to bandage, not to skin. You never want to tape to people's skin. I've seen people that have had horrible reactions to tape. And this is skin that's already somewhat fragile. So make sure you're taping to bandage. So now I'm going to ask the patient to lift their leg for me. And I'm going to look around and see where I have any holes. Try to smooth out any wrinkles as you go. You don't want there to be wrinkles because that's going to be an area of increased pressure. So there's a hole down here at the bottom that's open. There's a tiny little hole. I'm going to do something you shouldn't. I'm going to flip this over. There's a tiny little hole right there. Something that small I can probably fix just by shifting my bandages around. I will caution you on that. Sometimes you start shifting bandages around and you start this whole like cascade of horrible events that start to happen and you end up ruining the pretty bandage job that you've just done. So real small, you can probably tweak it a little bit. Anything much bigger than that, you're probably going to want to cover with something else. So for the second 4-inch bandage, so I want to cover back here a little bit. The goal, you want to leave an opening for the patella. Theoretically, it should be a diamond shape. I don't care what shape yours is as long as there's a hole for the patella. Okay? So now for the second 4-inch, you're going to do the same thing you did for the first one. You're just going to start on the medial side. So it's going to be a mirror image of what you just did. So it gets a little challenging with this too because now I was able to use my right hand more for that. I got to kind of use my left hand a little bit more at least to start with this. So I'm going to start back here so I can get this covered. I'm gonna come down over this corner. We'll cover a little bit of that hole. I'll get the rest of it later. Come up over here. We're gonna anchor around the thigh. So again, we're just laying this down. Kind of hold that in place there. Smooth out that wrinkle. And now we're going to go back to where we started and sort of reinforce that. Fix this wrinkle. And so now again, I don't need to go back up above the knee. I'm just going to use all this bandage to cover up as much as I can. Sometimes you have to play with the angles a little bit. You know you've got a hold on here, you want to cover it, but you can't come just straight down. You've got to kind of move it around a little bit. So do what you need to do. Feeling around to see if there's any holes left back there. And again, try to have a fairly even distribution of your bandage. You don't want it all in the middle, all at the bottom, all on one side. So just kind of keep moving up and down, making your figure 8 pattern. All right, we're going to end over here. So I'm going to take this off. Okay, so we can have the patient lift their leg. We can make sure everything's covered. I have a hole in the back. So I would want to fix that. I would probably start, I'll show you guys back here. We don't want that, okay? Because if there is swelling, it's all going to go right there and form a little pocket. So what I would probably do is unwrap my second one and start over so that I could cover that up. So these are the things we're going to look for when you're finished, okay? We're going to look to make sure that you've minimized wrinkles. You might not be able to completely eliminate them, but I want it to be pretty darn smooth. So do that as you go, okay? Look for holes as you go. I should have probably lifted the patient's leg at some point, saw that I had a hole back here, and I could have covered that up when I was doing my anchors in the back. So no holes. You don't want there to be any holes. Again, fairly even distribution. Again, I'll kind of give it a feel test. If I feel like it's all kind of bunched up right here, that means there probably needs to be some more down here. The other thing we check for is the anchor. I need to be able to at least fit a couple fingers underneath here. If this is too tight, it's going to form a tourniquet. Okay, so this needs to be looser up here than it is down here. When I check for that, I'm probably going to wrinkle it. So I will have checked for wrinkles before I go and mess up the pretty job that you just did. Okay, so those are the major things that we're going to be looking for this for the comp. Okay. Any questions about a transtibial wrap?
We'll be able to move the body like you did.
Yes. Now this, again, this is a person who you've been teaching to do leg lifts and